One of the most common sources of pain for pregnant women is the sacroiliac joint. These two joints, located at the back of the pelvis, affect not only the back of your pelvis and hips, but also down the back of your leg. This kind of pain can last through delivery and into the postpartum period. Most musculoskeletal pain in pregnancy is related to relaxin, a hormone that causes your muscles and ligaments to relax. Because the ligaments within and surrounding your pelvis are stretching and relaxing, your joints don't have as much support as they normally do. Ligaments provide stability, so if the ligaments are relaxed, it can lead to joint instability, which can lead to too much joint mobility or can cause other surrounding muscles to compensate, usually by tightening, and this can cause pain. Unfortunately, if you are hyperflexible, you are more likely to get this pain. Instead of performing hip opening exercises, focus on strengthening the glutes, the inner thighs, and stretching the psoas muscle. Luckily, there are things you can do to make yourself more comfortable, like seeing a physical therapist or wearing a maternity support belt. A support belt can really help with SI joint pain. The following exercises will help strengthen and support the surrounding areas and help alleviate some of the pain and discomfort you may be feeling. Begin lying on your back. Be sure to elevate your shoulders if you are after the second trimester in pregnancy. Have your knees bent and feet flat on the floor. Place a foam yoga block under your tailbone. Press your back into the block, keeping your inner thighs engaged. Slowly extend one leg, holding for 30 seconds or so, then bring your leg back in and extend the opposite leg. Make sure you are contracting or squeezing your glutes before you are slowly releasing your leg to stretch the psoas muscle. This will help to make sure you're protecting that sore area. Begin lying on your back. Elevate your shoulders after second trimester if lying flat on your back feels uncomfortable. Bend your knees and keep your feet flat on the floor. Place a yoga foam block between your thighs and gently squeeze. Feel free to gently rock the pelvis from side to side. Stand with your feet in a wide stance, toes pointed slightly outward. Press your hips back and slowly lower towards the floor. Squeeze the glutes, then come back up to a standing position. Stand with your feet in a wide stance, toes pointed forward. Next, step directly to the left, leaving your right foot in place. Press your hips back, bend the left knee, and slowly lower towards the floor. Your right leg should stay completely straight. Squeeze the glutes, then come back up to a standing position. Place an ankle strap around your left leg. Place the cable pulley in the lowest position and attach the ankle strap to the cable machine. Step sideways away from the pulley until the cable is pulled taut. Keeping your body and legs straight, exhale as you pull your strapped leg down and in front of your supporting leg. Return your strapped leg to the starting position and repeat this exercise with the opposite leg. Sit up tall on a chair or bench. Place a medicine ball or sturdy inflatable ball between your thighs. Squeeze your legs together for 5 to 10 seconds, then rest. Sit on the seat and place the feet in the foot holders, adjusting the pads if necessary. Your thighs should be pressed on the inside of the pads. Next, squeeze the legs together, holding for 5 to 10 seconds, then slowly release. Stand with your feet pelvis width apart and pointing straight ahead. Place a foam yoga block between your thighs and squeeze gently. Inhale to expand as you hinge at the hips, sending your butt back, and bend at the knees. Keep your weight in your heels. Exhale to engage your core as you straighten your legs to press back up. Begin laying on your back. Elevate your shoulders if you are after the second trimester. Your knees should be bent and feet flat on the floor. Place a yoga foam block between your thighs and gently squeeze. Next, slowly raise the hips off the floor towards the ceiling into a hip bridge position. Hold for 15 to 20 seconds, then slowly lower back down to the ground. Perform the single leg bridge on the weak glute side only. Lie on your back with a foam roller under the knee of your weak side. Grab your opposite knee and hug it up towards your chest. Engage your abdominals and slowly lift your hips off the ground into a bridge position, keeping your back straight. Hold briefly, then lower yourself back down to the ground. Perform the bridge with march on the weak glute side only. Lie on your back with your arms to your sides, knees bent and feet flat on the floor. Slowly lift your hips off the floor into a bridge position, keeping your abdominals engaged the entire time. Lift your leg 2 to 3 inches off the ground and try to do this without letting your pelvis tilt to either side. Kneel on the floor with knees shoulder width apart. Bring one hand to the floor alongside your knee, allowing the opposite leg to fully extend. Engage your core using a core breath, then shift your weight onto the supporting knee. Raise the extended leg 2 to 3 inches off the ground and hold for 10 to 20 seconds, then lower back down to the floor. Feel free to pulse the leg up and down if holding feels too difficult. This exercise will strengthen the glutes and inner thighs. Begin on all fours with your hands stacked directly under your shoulders and knees under hips. Make sure your back is flat and tuck your chin slightly so the back of your neck is parallel with the ceiling. Engage your core using a core breath, then, keeping a 90-degree bend in your right knee, slowly lift your leg up towards the ceiling, making sure not to arch your back. Start with your shoulder blades against a bench or balance ball. Bend your knees to about 90 degrees and make sure your feet are planted flat on the floor. Brace your core using a core breath. Squeeze your glutes, then press through your heels, lifting your hips up towards the ceiling, keeping your tailbone slightly tucked under. Hold for 1 to 2 seconds, then slowly lower back down to the ground. Place an ankle strap around your left leg. Place the cable pulley in the lowest position and attach the ankle strap to the cable machine. Face the weight stack and step back until the cable is taut. Hold onto the pole for support. Engage your core using a core breath. Hike the hips back and lean forward slightly. Then slowly kick the working leg back. Careful not to arch your back. Squeeze your glutes for 1 second at the top of the movement, then lower back down to the ground. Thank you so much for watching. Now don't forget to head on over to hollybrownfit.com and subscribe for the latest in pregnancy, health, and fitness videos.